Hello. Let's read out some articles in English. And this is issue 398, May 20, 2026. We use the method to read out the articles. It's just a practice pronunciation. So now we see these words we probably don't know, but we just spell out, maybe right or maybe wrong. Nocturia. The National Association for Cantonese defines nocturia as a condition that causes you to empty your bladders 2 or more times during the night. Occasionally, nighttime urination is normal, but frequent trips may signal another issue. Facts about nocturia. Nocturia is a symptom, not a disease, and medical experts have linked it often to multiple causes, including nighttime urine overproduction, bladder problems, or sleeping disorders. Sleep disruption is a major concern. Dr. Alison Huang, a primary care physician at the University of California, San Francisco Health, states, at its heart, nocturia is really a problem with sleep. Nocturia is common in men and women, with the most affected usually over 60, but it can affect anyone at any age. With aging, bladders become less elastic. Pelvic floor muscles weaken and prostates enlarge. Older adults spend less time in deep sleep, making them more susceptible to nocturia. Despite its relative frequency, nocturia is often underreported, poorly managed, and inadequately treated. Many people may not bring up the topic with their healthcare provider out of the embarrassment or because they hold the mistaken belief that nocturia is a normal part of aging. Nocturia is associated with the impaired quality of life and complications such as depression, cognitive dysfunction, mood disorders, and fall-related injuries. It increases the risk of obesity, high blood pressure, heart disease, diabetes, stroke, and cognitive decline. Common cause includes too many foods, caffeine, alcohol before bed, too many salty food, medications, underlying conditions such as diabetes, high blood pressure, heart disease, sleep apnea, enlarged prostate, urinary tract infections like UTIs, overreactive bladder, or pregnancy. Diagnosis may include a medical history, urine test, medication review, and a bladder diary to track nighttime bathroom trips. Treatment. The National Association for Continence indicates that nocturia has only recently been researched in more depth, so the treatment options are currently limited. The organization encourages people to take action now as the occurrences of nocturia increases with age. Dr. Dean Alterman, a urological surgeon at the University Health Network in Toronto, stresses the need to identify what's driving the nighttime awakeness and address it directly, as Dr. Alison Huang notes. Nocturia doesn't lead itself to a single magic bullet. Treatment focuses on the cause and often begins with lifestyle changes. Avoid food, caffeine, and alcohol before bed. Be aware that some foods have a high water content, such as celery, watermelon, and asparagus. Reduce sodium intake. Adjust the timing of diuretics. The American Urological Association advises people to take them in the morning or at least 6 hours before bedtime. Address behavioral patterns. When you have developed a routine of getting up during the night to use a bathroom. For an overactive bladder, consider physical therapy for a pelvic floor exercises. Elevate swollen ankles and legs to help distribute fluids so they can be reabsorbed into the bloodstream. Wear compression stockings. Improving sleep hygiene. Manage underlying conditions. For example, for sleep apnea, you may consult a sleep specialist and use a CPAP machine. People with type 2 diabetes should look to manage their condition. Medications. The National Association for Continuous comments different medicational options exist to elevate, and even treat nocturia. This may be used alone or combined with some behavior modifications, which has been proven to be more effective. You may be prescribed medications that include bladder muscle relaxants, drugs that limit urine production at night, and antibiotics if you have a urinary tract infection. So these is articles we read. And I haven't read for a while, so many pronunciation, the words is not correct. Today we read the term called nocturia. Thank you for listening, and thank you. I'd like to contact us to read together on the Zoom. We make appointment or pay attention to the notice. Thank you very much. Have a happy life.